Welcome to the Limestone Surgery Center. The purpose of this video is to acquaint you with the surgery center, streamline the check-in process, and hope to make your experience as stress-free as possible. Limestone opened its doors in 1988, being the first outpatient freestanding surgery center in Delaware. We are licensed by the Delaware Department of Health, certified to participate in the Medicare and Medicaid programs, and accredited with the Accreditation Association for Ambulatory Healthcare, known as AAAHC, a gold standard for surgery centers. Many of our nurses and staff have worked here for many years and have developed a great relationship with the physicians. This strong bond allows our nurses to provide efficient, high-quality care to you during your visit. Our center performs a wide variety of outpatient procedures. The following is a sample of frequently performed procedures. On the day of your procedure, we ask that you arrive at the time that was assigned to you. Please check in with the receptionist. The receptionist will confirm your ID, name, address, insurance information, and confirm that you have a driver to safely get you home after the procedure. If you have not yet received your patient rights and responsibilities pamphlet, you will be provided with a copy. You will be asked to be seated in the waiting room until your pre-operative nurse calls you back to your private patient room. In most cases, your driver can remain in this room while you're in surgery. Your pre-operative nurse will interview you. The nurse will confirm your identity, the procedure you will be having, as well as confirm medical history and medications. The nurse will then have you sign your consent to perform your procedure. The nurse will provide instructions and answer any questions you may have. If applicable, an anesthesia provider will make introductions. For your safety, they may ask some of the same questions you have already answered. The anesthesiologist will then start your IV. There are several types of anesthesia that could be given, and the anesthesiologist will explain the type that you will be receiving. Your operating room nurse will come to you next. They will make introductions and explain to you the next steps. You will be transported to the operating room or procedure room, either by gurney or walking there yourself. The Limestone Surgery Center has 4 operating rooms and 1 procedure room. Here is what one of our operating rooms looks like. This is where our highly talented team of operating room nurses will provide you with step-by-step information on what you will experience during your procedure. Once you're in the operating room, our team of nurses and your physician will call a time out. This is done for safety, where the team stops to ensure they have the right patient, the right procedure is being performed, with the right staff and the right equipment. Our professional staff will ensure that you are comfortable and do not feel vulnerable while in our care. They will respect your modesty at all times. Once the procedure is completed, you will be transferred to our post-operative area for observation for approximately 30 to 60 minutes. At the end of this time, you will be transferred to your private room where your escort or driver will be waiting for you. Your post-operative nurse will review discharge instructions with you at this time and make sure you understand them. Your physician will visit you to answer any questions you may have. You will be discharged by the post-operative nurse and escorted by a staff member out to the vehicle waiting to bring you home. You should expect a call from one of our nurses within 48 hours of you going home. We do this follow-up call to check on your recovery and again answer any questions you may have. We ask that if you have any questions pertaining to your procedure that you please call your physician's office directly. This will enable your physician's staff to answer your questions promptly. Our staff wants to thank you for visiting our center and hope that your experience with us went beyond your expectations. Before your visit, you should expect telephone calls from our billing department to verify insurance and co-payment information, and, if applicable, a call from the anesthesia department to ask some pre-operative questions. Please take the time before the day of your surgery to visit our website, www.limestonemed.com, to familiarize yourself with our center and review the patient information page. This page includes a variety of helpful information and a checklist of items to remember before you leave home to come to the surgery center. We are located in the Limestone Medical Center at 1941 Limestone Road, Suite 113 in Wilmington, Delaware, zip code 19808. We are centrally located and have convenient parking for you when visiting our surgery center. Our phone number is 302-633-9873, and we are open from Monday through Friday from 7 a.m. until 4:30 p.m.